Ready? Good afternoon. Today I'm joined by the Secretary of Health, Kim Malsom-Risden. And going into this week, I knew there would be some questions as to if the legislature would be called into special session. So I wanted to talk about a little bit of spending and revenue projections and plans. We have some buckets that will be addressed through spending going forward, including healthcare, small business, education, and local governments. I want to be clear, the state of South Dakota has received dollars through the CARES Act, but we will not be spending all of that money at the state level. It will be dispersed into these different buckets and areas for local governments and businesses going forward. The balance of these dollars will be held to fill immediate needs, but also we need to make sure that we're not just addressing immediate needs and covering costs for some of these local governments, but saving some dollars that we could potentially use for revenue replacement should that flexibility be granted to us from the federal government. Based on what we know today, we most likely will not need a special session in the month of June. And that would be before the end of the current fiscal year. Potentially we could need one later on, though. Revenue numbers will be in next week, and we'll have a better picture then as to what we're looking at. I signed 2 executive orders today, one regarding state licensing boards, and the other one that is extending our state of emergency for the state of South Dakota. That second executive order is necessary because federal law requires us to have it in place and in order to be able to access federal dollars. The details of those executive orders will be on the covid.sd.gov website. I wanted to address a little bit of education spending because there are different areas to which education dollars have been flowing to the state. The CARES Act provided grant funds for all levels of education. Between 3 different federal funds, South Dakota Public Schools will receive about $68 million. The Higher Education Emergency Relief Funds amount to about $19 million, and they went directly to 10 colleges and universities in the state. Half of that money is allocated to students to help cover costs such as food, housing, technology, healthcare, and childcare. The other half is used by our colleges and universities to defray some of their expenses that they incurred due to COVID-19. Tribal and private universities also received funds, and that totaled $7.6 million. Another area is elementary and secondary schools. Their elementary and secondary schools emergency relief fund amounted to $41 million. That will be used to provide educational services to their students, for cleaning their facilities, for adapting to help meet their health and sanitation recommendations, providing technology and internet connections for students through remote learning, among other things. Again, that amount was $41 million that went to education and elementary and education secondary schools relief. The third bucket is the Governor's Emergency Education Relief Funds. This was $7.9 million. Then $5.7 million of that was prioritized for quality remote learning, teacher professional development, and supporting students as they come back into the building. The other $2.2 million of that 7.9 will go to support workers who had layoffs or closures tied to those businesses where they worked. We've considered all of these grants available to us, and we're determining how to use those to provide schools with the most flexibility. And we'll be announcing soon grants for private schools and for universities as well. With that, I will open it up to any questions that you might have.
Governor JP from KORN News Radio.
Sure, go ahead, JP.
Thanks. Can you give us an update on the checkpoint situation?
We still have an ongoing investigation going on, and so therefore I'm not going to be able to provide more details for you today, JP.
Okay, just to follow up on that, have you received any response yet from our congressional delegation, Department of Interior, Department of Justice, or the White House?
No, we have not received any follow-up communication from any of those entities.
Thank you.
You bet. Bob, did you have one in the room? No?
Governor, this is Stephen Grubbs from AP.
Sure, go ahead, Stephen.
I'd seen that the president is considering a different location than North Carolina for the Republican National Convention. I was wondering if you had considered or have any plans to put South Dakota forward as a possible host for the convention.
No, I had not put a proposal forward to do that. Any further questions? Bob?
This is Lisa with the Argus Leader.
We'll do Bob, and then Lisa, I'll come to you.
Governor, Bob Mercer, Colorado News. Given the news that came out last week about the COVID-19 app, have you downloaded it on your phone? And secondly, do you have any concerns about it at this point?
I don't. I have downloaded it on my phone, so it is there. I don't have any concerns about privacy issue. It's a voluntary tool, and no private information is shared unless the user opts in at a certain time to voluntarily do so. And if folks would like to see the privacy policy on the CARE-19 app, it is available on covid.sd.gov. Okay, Lisa, go ahead.
Yeah, just wondering I just wanted a clarification on the amounts that you were describing. Are those part of the $1.25 billion that the state is receiving, or is that separate?
Yes, it is a part. It was part of the revenue that I talked about. Was that there's separate education dollars that also came in, but the amounts that I referenced in my opening statement is what was in relations to the CARES Act.
Okay.
The total.
And at this point, how much? Yep, go ahead.
No, the total between the three, secondary education, the K-12 system, and then also the emergency education relief funds is $68 million in total.
Okay. And then how much, at this point, do you know how much is going to, cities and counties?
That is something that we'll be bringing a plan forward soon. We'd like to deploy some of those funds as soon as possible because we know that counties and cities are incurring costs as it relates to taking care of folks through COVID-19 spread in the state. I do want to remind everybody, though, the $1.25 billion came to the state, and there was no requirement that the state pass along any revenue to our counties and cities because the language in the bill did not say that that had to happen with cities of a certain size, of which we don't have any, but we will be in the state of South Dakota taking some of those funds and deploying them to our cities and counties to help cover their costs. While it's not required, the state of South Dakota will be sending dollars to those entities.
Okay. Have you heard from the Treasury about using the money as a revenue replacement?
We have have some indications that they're still continuing to look at it. They have been good about giving us some flexibility in the dollars that we've already received. So that's been helpful. We still, though, for the next fiscal year, really would like to see them give us some ability to use it for revenue replacement because of the impact we're seeing to our economy. And that can be helpful through language, through Treasury, or Congress could pass a bill that would have that language and put it directly into statute.
Ma'am.
Yes.
Joseph with Capital Journal. How much of that money budgeted for the school is the state still short money after all that money comes in? Because I know last year or in this past year, legislation was passed to give schools like a 2% increase, and I know talking from both Stanley and Pierre, their superintendents are like, yeah, we're not. And most of the people they're we're not going to put that in our budget this year. We're just going to run at a zero. Is that, I guess, advice that you would give going forward? I mean, you're still battling for them and stuff, but.
Yeah, I think the superintendents that are putting their budgets together that way are being responsible. We will see revenue numbers the first week of June. That'll give us a lot more guidance as to what the current fiscal year budget will look like and what next year will look like as well. A lot of these dollars are tied to costs that the schools could not have anticipated. Doing extra cleaning in their buildings, responding to health requirements, implementing distance learning. Some of those things were things that the school districts didn't have in their budgets and was extra cost to them. So, but we're looking for the ability to continue to help our schools be funded at a level to which we committed. We just possibly will still need some revenue replacement flexibility in the language, and then we'll know a lot more after we get those revenue numbers next week.
This is Morgan at the Jackie with SDPB.
Let's go to Morgan, and then we'll go to SDPB.
Can you talk about any planning or conversations you're having going forward about how schools will return in the fall and whether that be another statewide decision?
I was visiting with my Secretary of Education, Ben Jones, this morning a little bit about that. I think every school district is approaching it differently. I think they're planning to have students in their buildings, but yet putting in contingency plans should they need to make an adjustment at the local level and have kids learn from home as well. So I think they're being wise in preparing for any situation that could come along this fall. And I'm sorry, I didn't know who we had on that question from SDPB. Jackie, was it?
Yeah, thank you,
Okay.
Governor.
Yep.
I'm wondering if we can have an update on the statewide hydroxychloroquine trial and if we can have a response on the World Health Organization suspending their study.
Sure. Jackie, this is Kim Malsom-Reisen with the Department of Health. So the experts that are conducting the study are taking into account every single other study about hydroxychloroquine, and so they'll look at the most recent one with the World Health Organization as well. The thing that I would just tell you is that, you know, there's about 175 studies across the country and across the continents that are dealing with hydroxychloroquine. They're all different in terms of who they're treating, the type of regimen that they're using. And so just because we see one study that is not moving forward doesn't mean it's necessarily comparable to the study as it is in South Dakota. But, you know, again, we will be looking at those study results and making sure that the safety protocols that are in place for the South Dakota study remain strong and will protect people from poor outcomes.
Thank you. And do we have a number of people that are now enrolled in those trials?
I don't have the number today. I know we enrolled our first person here just a couple of weeks ago. There's a process for people that are interested. You can find information on the covid.sd.gov website, and there's a phone number for folks to call. The process is then, once you do that, you'll be kind of vetted through some questions to see if you're a viable candidate for the clinical study, and it'll proceed from there if that's in fact the case.
Thank you.
One thing I would add is that Sanford Research is leading that trial, and so many of those questions too, I'm sure they'd be happy to answer. Yes, Bob?
Has another tribe stepped forward yet to show interest in mass testing?
We do, yes.
So we've got, last week we had the mass testing at Sisseton-Wahpeton. That was a joint effort between South Dakota and North Dakota, and by all accounts, I think the tribe was really pleased with how that turned out. So we are now working with Standing Rock. We're working to try to get them testing supplies. They have a very robust plan to test folks in different South Dakota communities as part of their reservation. We are also reaching out to Yankton, who has expressed interest, as well as Rosebud. And so I expect that in the coming weeks we'll have more details around those kinds of testing events in many of our tribal areas.
Just to follow up on a different point earlier in this briefing, has the Oglala Sioux tribe or the Cheyenne River Sioux tribe formally responded at all? No.
Responded to?
Responded to.
I thought you were going to ask if they'd requested mass testing.
Well, that's next. But
Okay. Well, no, they have not formally responded. I think we got some communication from one of the tribes, but they have not accepted the 3-point plan that I presented to them as far as moving their checkpoints to BIA roads and being able to facilitate them there. And we're still hopeful that they would consider that plan going forward. And then I'll let Kim respond to the mass testing.
Both Cheyenne River and Oglala Sioux Tribe have been participating in calls that we've had for updates, but as of now, they have not reached out around mass testing for their residents, and we hope that they will do that.
Further questions? Okay.
This is Stephen Groves from the AP.
Go ahead, Stephen.
Sorry. I understood that the Vice President had a call with governors earlier today. I'm not sure that you were on that, but if you were, could you just maybe tell us a little bit about what was communicated and just a reaction to that call?
Yes, I was able to stay on that call for about an hour and 45 minutes. The discussion was mainly around supply chain, making sure the governors had supplies, letting us know updates on testing equipment, and also how states were doing and how reopening plans were going for many of the other states. So he gave an update, as well as Dr. Birx talked for quite some time, and then FEMA gave some information. So it was a pretty general weekly update phone call that the Vice President holds with governors, with input from governors across the nation. Okay, thanks so much. Have a good day.